Now, Phelim Donnelly, Dr. Phelim Donnelly, you got involved in medical politics. How did that come about?
Well, when I came back from England, I immediately joined the medical union, and the Irish Medical Association, which was
Called the IMA at the time.
It was the IMA then,
Yeah.
and it was a corporate branch of the BMA. So I was very strongly then in favour of the union, because the union was the medical union, not of Ireland. It was the medical union of the two islands. So I joined them both, and for a while for one while there I was secretary of the Galway branch of the IMA, and I occasionally gave lectures, you know, the medical lectures they had. Some of the sessions would be 40 minutes of medicine or surgery or midwifery. I gave a few lectures there, and then I went for a position on the Council of the Medical Union, and was elected as the Western representative of the Medical Union. And I was very taken with the medical union's egalitarianism, fairness, that it was originally founded by a group of GPs, as you know, who were very dissatisfied with the treatment they were getting from the Irish Medical Association. But what I noticed is the GPs who founded it were anxious to have consultants and junior doctors in it as well. But the original thing was to emphasize the need for someone to represent their needs, where they were being neglected by the Dublin focused IMA, who were very, very buddy with the consultants of Vincent's in particular. And there was an obvious lack of interest and balance in the rest of Ireland, particularly the west, the Donegal, west all the way down to Cork. But I noticed the GPs who were in the union then were anxious to have it evenly spread. So there was an association already in existence that consultants had done the same in the west of Ireland. A Limerick group had formed a group of local authority medical specialists to oppose the IMA and present their own views of country doctors, country consultants, led by the Limerick consultant. He was a Protestant. The man, they had a lemonade factory there as well in Limerick, famous. Nash, okay. Dr. Nash, that was it. And they formed this, and the secretary of the medical union came along to them and said, look, the medical union, it was founded by GPs to rectify the balance and get some fairness in presentation and representation, but it has very few consultants. Would you agree to join en masse the medical union, and we'll give you equal attention for your needs as well? You can continue to exist as you are, but you can work through us. So the whole group apparently joined the medical union. About 2 or 3 years before I came to go to Westport, to Castlebar, to Galway.
Did they have a negotiating license that time?
They applied for it, but because this happened, they withdrew the application on the last day.
Okay.
Which I told them afterwards they should have gone on with it, but they withdrew it.
And did they get one later?
No. Oh. But from then on, I noticed that it was very fair. The medical union elected its president at the AGM, and nobody knew who the new president was going to be.
Until the
Whereas
AGM.
the IMA had
it's selected
around the year before And they had pre-selected him. When you came to the AGM, you were told that this man is going to be. So the medical union used to elect it, the new council elected their own president on the first meeting at the AGM, which was very fair.
Democratic.
Exceptionally fair. There were a very group of very brave, strong-minded GPs who soldiered very hard in the wilderness for a long time, but won a lot of things for themselves as a result.
So you became president at one stage, I suppose.
I became president of the medical union, and then subsequently I became president of the new IMO.
Which was an amalgamation of...
Yes, there was a meeting where they voted, the members voted that the IMO be now taken in en masse into the medical union, and then subsequently there was a national vote as to whether you change the name. So they changed the name from the medical union to the Irish Medical Organisation.
In Kilkenny.
That was it, yes.
Remember it well. So
It is reported.
the divisions continued.
It did. It did.
We seem to have a, what would you call it, an affinity for division in Ireland, don't we?
Well, it seems that, but I noticed that there's a tendency for cliques to form, and I noticed there was a great division between the southwest of Ireland and the west of Ireland, and they thought differently, and I thought the west of Ireland held onto the original sense of fair play on the founders of the medical union, whereas the Cork people were beginning to exert the same type of, or show the same type of philosophy and exert the same type of strength as the old IMA did in Dublin.